In this episode of the Nurse Practitioner podcast, Dr. Sheila Melander and Dr. Lacey Buckler discuss COVID-19's effects on NP scope of practice. I understand you would like to share some current legislative issues regarding COVID-19.
Yes, we thought that it was important to share and make sure that all of our listeners were aware to contact their state boards of nursing, or if they needed some activity to happen that they weren't seeing happen, that is an option for them. We're very fortunate in the state of Kentucky. We have as our Kentucky Board of Nursing Executive Director, Jennifer Estes, who is an APRN. So that has really, I think, been quite advantageous for us. We did reach out to Jessica, and we had a couple of questions. We had been contacted by mainly UK Healthcare because they do hire mostly the majority of our graduates, but we had been contacted to find out were our graduates going to be ready to start working as they had predicted, or how did COVID-19 affect that? And so what our Kentucky Board of Nursing was able to do in conjunction with KNA was to reach out to our governor to be able to have some bills passed, and I wanted to share those. So the first one was a temporary work permit for reinstatement of applications. So this allowed for issuance of temporary work permits to a nurse or a dialysis technician also who'd applied for and were eligible for reinstatement for either a lapsed or a retired license. And this emergency regulation is effective immediately. And the temporary work permit that goes with this expires after 6 months. However, the board can actually even extend that period if that criminal background check, which is a process that has to occur with this. And right now, that's going to need to be restored. So we'll just keep an eye on that. But they went ahead and did an allowance for that to be extended if needed. A second area was APRN collaborative agreement requirement has been lifted. So that's going to suspend that collaborative agreement during the duration for COVID-19 because of the state of emergency, and that's Senate Bill 150 for us. So that is a huge help to us. Now, along with that, APRNs who prescribe controlled substances still need that DEA registration and that CASPER master account in order to review that data. But this will be a huge help to keep things moving and allow for practice at the highest level of scope of practice for our APRNs. A third change or modification was the clinical education requirement's been modified. So this is more in effect for our undergraduate students, but what a tremendous help for that workforce that's going to be needed. So they're not going to enforce the 120-hour integrated practicum requirement that necessitates direct patient care. So that will allow for increased threshold for simulation. Similar to this, AACN and ANCC are allowing us for graduate programs, as long as those students have met those direct face-to-face 500 patient hours, you can complete the hours other ways. So, for instance, our program requires 720 hours. So that's an additional 220 hours if that are graduating students. We can come up with innovative ways to meet those hours, as long as those face-to-face hours have been met. So we're doing things such as additional simulations, such as using Shadow Health, which has the avatars. So that will open up some doors for the graduate programs. That last provisional licensure that was approved by our state was for exam applicants and for temporary work permits for endorsement applicants. So this is going to really help us with our new grads, because if we did not have this, it would really be an extended delay in processing, because we use a fingerprint-driven criminal background check. So this provisional licensure will allow for this to continue to go on, get those new grads in the workplace. Again, it expires after 6 months, but the board can choose to extend that. So Lacey, hearing those and Lacey and I work really closely together. Lacey is over the APRNs at UK Healthcare. We work very closely with the College of Nursing. So we are hoping that this will help with the combined efforts to maintain that workforce needed to address this COVID-19 emergency. So, Lacey, if you could speak to those now, that would be great.
Thanks, Sheila, so much. I can't say enough about the partnership with the College of Nursing here and how we've been able to work together to ensure our workforce is ready to go. One big piece of legislation that helped us was the collaborative practice agreements and the removal of that during this emergency time. We have over 500 advanced practice providers here at UK Healthcare, and in order to be able to ensure that they're in places that can help the most amount of patients for their skill set, we really need to be able to be flexible and move them from area to area. So removing the collaborative practice agreement helps us be able to do that so that we don't have to, continue to ensure we have a bunch of paperwork that backs it up. We can really pull them quickly, get them into that site, and make sure they're helping take care of our patients. The provisional license piece is also really important to us. That way we can get folks in, ready to go, and help supporting our teams. We haven't seen the surge here yet at UK Healthcare, but we want to be prepared, right? And so we want folks that have that skill set and that are newly trained in those areas to be able to support our teams and step right in and really support Kentucky and to help all of our areas be prepared when the surge hits.
We understand you are overseeing efforts to prepare for the utilization of APRNs when the surge hits Lexington, Kentucky. Can you share what you are doing to prepare mobilize APRNs?
Absolutely. So I think early on we understood, I remember it like it was yesterday, March the 6th was our first case here, and starting from that day forward, we wanted to make sure our workforce was ready. So I've partnered with our medical staff office here who does all the credentialing and privileging, along with our chief medical officer and chief physician executive, to really review all of the APRNs and all of the PAs and CRNAs and clinical nurse specialists and certified nurse midwives here at our system to understand everybody's skill set. On a normal basis, I run the Office of Advanced Practice and am deeply involved in who's credentialed to do what and all those things. But we went through each and every provider, grouped them into where their current skill set is and abilities, and looked to see where we could best use them when the surge hit. We're following the Society of Critical Care Medicine has put out some really great tools that we've been using to kind of build platoons, for lack of a better term, that are groups of APPs led by APRNs, along with our physician faculty, to partner together to take care of groups of patients that are positive for COVID. And in doing that, we've been able to pull some of our critical care APRNs to the forefront of that to lead, and we've partnered them with our certified registered nurse anesthetist, who historically have played a big role in our operating room, but because we're not doing as many elective procedures, we've pulled them out of there to be specialists in the airway and also specialists who do a lot of our procedures. So those two groups have partnered together to make sure we have teams ready to go when the surge hits. I will tell you, we've also pulled all of our CRNAs. We have a pretty large group, about 60 to 70. We pulled them out and really had them focus on emergency airways in our hospital and getting that started now. So they're going out now and responding to our codes, responding to our procedural areas, to practice being the person that's there first and foremost and has all of the protective gear that they need to be ready to intubate patients that they come across that might be a person under investigation or a COVID positive patient. Another thing that we're doing is looking at, we've partnered with the campus and we have set up a field hospital here at the University of Kentucky over in one of our athletic departments, and we are preparing to use that. We're starting to train for that next week. And in doing that, we've pulled a fair amount of our team members who have some training in the hospital as APRNs, but also have some training in the ambulatory setting. And so we're working with them to understand their role in the field hospital and how they can help transition those patients to home. Another huge piece I can't say enough about is telehealth. So we mobilized telehealth very quickly as soon as we saw that we needed to keep our patients out of the facility. We treat a lot of, we're a quaternary transfer center where we take many patients with critical illnesses, including a lot of transplants, a lot of immunocompromised cancer patients. So we wanted to make sure we could still care for those patients during this time. So a fair amount of our APRNs in the ambulatory setting have ramped up their telehealth. We've gotten those partnered with our medical assistants to ensure that all our patients still have access to care during this time. So lots and lots of moving parts, but continuing every day to see what we can do to make sure we're prepared when our surge hits, or just to continue current care for our patients so that we don't lose track of that at the same time.
What have you learned from areas where COVID-19 has already peaked that you hope will help in your preparations?
Yeah, so I am fortunate to be a part of a network of advanced practice provider directors across the nation. And so we've had a couple calls together, or we're up to 3 calls now, where we've kind of all spoken together, folks from NYU Langone, from Ochsner down in Louisiana, University of Alabama, Birmingham, my colleagues in Cleveland. We've had time to spend together about an hour phone calls where we can bounce ideas off of each other and really see what's working where. A lot of discussion around scope of practice and how folks have pulled people who normally don't function in a certain environment and really partnered them with people who do, so that everybody can practice to the top of their license and use their skill set the best. I think one of the best pieces of advice I've gotten from folks who are already in the middle of the surge is to ensure that you have leadership backup. So I think a lot of the leaders in the area who are really overseeing a lot of the operational detail, there have been a couple of those folks who've been affected by COVID, and there hasn't been a plan to replace them. So I think it's really important for teams to have internal succession planning for the moment, to make sure that you are prepared with somebody who knows all the things that you know, so that you can have them step in if something happens to you. Really understanding that you have to have backup plan after backup plan after backup plan ready to go has been some of the best advice I've received. Folks seem to be doing many of the same things across the nation, just building platoons of providers to make sure that you have enough bandwidth to take care of a surge if it were to happen.
What message would you like to leave the audience with today?
I think my biggest message is partnerships, and I think that came through clearly with our discussion with Lacey today, but to embrace that, and that the only way that we will get through this is working together. And I also want to make sure and emphasize the importance of knowing, as a nurse practitioner, knowing what legislation that we have that has been passed that can assist with the efforts that you have. And I also want to have everyone that's listening to hear and take note of how APRNs are performing without these added restrictions in these states where this has become a possibility for us. And I think it's so important we not lose sight of this opportunity to show the public how we can perform at the full scope of practice. And then that just begs the question, if we're able to do that during the state of emergency, then why would those restrictions need to go back on our APRNs across the country? So I just think that this is very timely. If you haven't had a chance to check your state legislation and see what's out there that can help you battle this, please do that as soon as you hear this today. And then secondly, be taking note of all those wonderful things that our APRNs are doing. I've always said if you can't figure it out, or if you're trying to figure out how to handle an obstacle, nurses are your best ones to figure out how to make that dream come true or how to accomplish that task. So I think those are the 2 big messages I'd like to leave the audience with today.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.